much, Phil, and I'll leave it to you.
Okay, thank you. What she didn't tell you is that when we went to Base Academy together, Paula had won like every award there was to win at the time. so thanks you all for joining us today. I am very excited to be here. I don't get home often too much, so it's really nice to get back and see some familiar faces, some familiar areas like this place, Burt's. I mean, we used to have high school parties in here a long time ago, so it's really interesting to be back here as an adult and doing some serious conversations and serious talks. So without further ado, I mean, well, I guess we'll get into why we're here. Mental health, illness, chronic illness. When you think about chronic illness in particular, I mean, you don't just think about the physical aspects of it. I mean, you do think about the physical aspects of the day-to-day, but sometimes we aren't thinking about the emotional aspect, right? So like sadness, grief, denial, these sort of things always sort of, they follow a diagnosis. I mean, and then on top of that, there's the financial aspect, right? I mean, you're paying to go to the hospital, you're paying for medicine, things like that. There's a growing recognition of the link between mental health and physical health. But to effectively treat chronic illness, there needs to be a stronger integration of mental health, physical care service, primary care services, and specialty care services. And so when we think about Black Americans in particular, we are at high rates of chronic illnesses, so diabetes, heart disease, gut issues. And when we sort of think about these, I'm thinking about Wayne County, right? So like, let's talk about Wayne County. Poor health outcomes are connected with years of segregation, disinvestment, poverty. That's where we are right now, and right here in Detroit. No matter how much it changes, a lot of things still stay the same. Whenever I come back, I'm looking at the neighborhoods, which still kind of look the same, you know, even 20, 30 years ago. So there's growing research into the effects of systemic racism on how it actually affects health, our bodies. This process is called weathering. A public health researcher at the University of Michigan, Arlene Geronimus, she actually coined this term in the 90s, and we're seeing more effects of this today. She thought that the normal sorts of ideas behind, you know, why we are dealing with these chronic illnesses, it's not just diet, it's not just exercise, it's not necessarily genetics, but more so those issues don't actually talk about the accumulation of effects that we deal with through poverty, through racism, through discrimination. So, I mean, when I think about that sort of thing, I'm thinking about East Canfield, right? So East Canfield, a neighborhood on the east side of Detroit. There's a plant that's been there since the 50s, formerly Chrysler plant, now Stellantis. The residents over in that neighborhood, they have some of the highest rates of asthma, some of the highest rates of chronic obstructive pulmonary disease. These are respiratory illnesses. They have higher rates, up to double and triple the national US average according to the CDC. So we're gonna break down a lot of these topics, a lot of these issues that we're talking about today. I'm glad to see that so many people are here to talk about these things, because health usually is something that we're not always concerned about until, you know, it's too late sometimes, right? So today we're joined by 4 amazing panelists. Usually I'd read from, you know, from my cards here, but I think it's more interesting and more personal if they introduce themselves. So let's start off here.
Mic check, okay. Hi, everyone. My name is Adria Moses. I am the founder of the School of Radical Healing, a BIPOC-centered space where we teach self-regulation and promote trauma recovery through somatics, love, and language. I am a trauma-informed mindfulness facilitator, and I have been living with Crohn's disease for almost 20 years of my life.
Good afternoon. You hear me? My name is Amirsadri. I'm a associate chair for clinical services at Wayne State, and also am a medical director for Neighborhood Service Organization, or NSO, and professor of psychiatry in the Department of Psychiatry at Wayne State.
I'm Olufemi Kasim. Most people just call me Femi. I'm a gastroenterologist practicing in Chicago, Illinois. Gastroenterologist means that I'm a physician who treats disorders of the GI tract or the digestive system. I do a lot of procedures, meaning things like colonoscopies and upper endoscopies, but I also see patients in the office where I mostly see folks with what we call disorders of gut-brain interaction. And we'll talk about this, I think, a little bit more later, but essentially disorders in which patients can have really debilitating symptoms that are closely related to their mental health and their mental state. So glad to be here. Thanks for inviting me.
Good afternoon. I'm Jonathan Edwards. I'm a therapist based in Ypsilanti, Michigan. Primarily, I'm at the Corner Health Center, an integrative health center in Ypsi. We provide medical care and mental health care to young people ages 12 to 25 and their families. I think that's about it. Yeah.
Okay, thank you. Please applause. Yep, go ahead. They're doing some really good work. So I don't want this to be where we're just necessarily just talking to you. If you have a question or comment, please feel free to raise your hand while we're having this conversation. There's a mic over there. Paul has a mic right there. But let's just start off with Adria. Let's see. So this is a discussion on an experience through which you've actually lived. Can you talk about your experiences dealing with Crohn's and just can you talk to us about that?
I like to be mindful of, whether we know what Crohn's is or not. I always inform people that Crohn's disease is an autoimmune illness that affects the GI tract. I was diagnosed when I was 12 years old. My father also has Crohn's disease and was diagnosed when he was 11 years old. So there's a hereditary component as well as, of course, physical mental health. As I became a teenager into my adulthood, I suffered with this illness. And when I was 19 years old, I had an emergency surgery. And a lot of my work is informed by this time in my life. I was not aware of the resources that are present. I'm from Inkster, Michigan. I didn't mention that in my intro. But where I come from, there's not a lot of knowledge or support in that area. And my dad would always tell me, your mind is going to heal you. Your mind is going to heal you. But I struggled with that because I couldn't get in touch with my mind because there was a war in my body. And so when I was 19 years old, my bowel actually perforated, meaning that it opened up. My Crohn's symptoms, my illness had become so severe that I had an emergency surgery that left me on life support and hospitalized for 2 months. I survived that time in my life, and it led me to a lot of places, which we'll touch on later. But the point of me sharing this is to also share that it greatly impacted my mental health. Not just the surgery, but living years and years with chronic pain. You never really get to focus in school. Your friends don't really understand you too much, and you're constantly just trying to manage something that is really unbearable. And we don't talk enough about chronic pain and how many people actually live with it. I always include a little bit about my dad because he is an addict. He turned to a certain method of caring for his pains. And I've kind of turned the opposite way towards holistic health. But over the years, I've just grown into this illness. Surviving, I always identify as a survivor first. And I go to U of M to get my care. I go to the yoga studio to get my care. I go to my altar, my spiritual practice to get my care. But, you know, in terms of living with the illness, it has been a complicated 2 decades of my life that without support and without agency and without choice, I probably wouldn't be sitting here with you all today. So I don't want to be too drawn out because it's a deep-rooted thing, but I love to share that we do exist, and probably someone around you has a chronic illness. Someone around you is probably suffering with chronic pain. And the more we know, the more we can show up and care for one another. So thank you.
Yeah, I'd say that it's more than likely that somebody around us is suffering from some sort of chronic illness, especially if, as Detroit, we're usually on different lists of like asthma or diabetes, like high, lists of that we disproportionately are suffering from these sorts of some illnesses. So yeah, absolutely. So for Jonathan and Dr. Audrey Sabri. Oh yeah, yeah, yeah. For Dr. Amirsadri, excuse me. Ali. Okay, for Dr. Ali, please tell us more about your experiences working in Metro Detroit. Just tell us more about kind of the challenges that your patients are facing, and what are some of the barriers that they face in getting adequate treatment?
Thank you. It's a great question. The challenges is what you mentioned in your introduction, is the system which was not designed to assist individual to receive help. It was a system which was designed to work on crisis and just remove the pain, supposedly, and let people go back to whatever they were doing. And that is the biggest challenge that we have. And now that system, you can attach to it systemic racism, as you mentioned, about race. But it is also systemic poverty. It is, and when I talk about poverty, I don't mean financially. I mean in every aspect of it, which means lack of resources for people who want to receive or need those resources. So when you talk about the challenges, not having enough resources, having resources which are not designed for a particular population, particularly when we are talking about Detroit. So there are many, many layers of challenges that we have, and I hope through people like yourself and others who have more knowledge, more information, more exposure, try to educate the policymakers to design services which are meant to deliver care in its true manner and add value to people's lives, not just look at people as, okay, you have headache, this is a pill, and you go and go home. These are things that need to be looked at from the infrastructure part rather than up there and top down looking at it. So in every aspect of what I said, Detroit is there. And the hope is that we all together, those who care and those who have not been alienated yet, and those have some form of connection somewhere, try to make the changes, as I mentioned, to go to these policymakers and politicians and bring them in here, show them what they see, what if they can live one night in the streets of Detroit, and I really encourage them to do so, then they get it a little. If they walk from one of these neighborhoods, just walk by themselves, probably 5 blocks, then I will say that probably you got 5% of what you need to do. So that's what I believe, that's how I look at it. And the challenges that you mentioned, those are the challenges.
Yeah, I want to co-sign everything you said, and also speak specifically to the population that I often work with, young people 12 to 25, as the language about mental health, or as young people are talking more about mental health, thankfully, the people that I see are often like breaking generational cycles in their families. Maybe the first people in their families to acknowledge that mental health is an issue for them. And so they've been told, from their peers or from social media or what they're experiencing, I need to see a therapist. And then that's often like where it stops. We don't know how to find a therapist. We don't know how to choose a good therapist. We don't even know like what it looks like to be in therapy. And that is a significant barrier, because if I can't conceptualize what mental health care is going to look like for me, then it's scary, and I just won't do it. I'll lean on what my family has been doing for generations, and I'll just kind of white knuckle it and grit my teeth and try to make it through. So helping young people see what therapy actually looks like, holding their hands through the process of finding a therapist, accessing care. What do I do if I don't have insurance? Does that mean I don't get therapy? Being able to inform this generation with the answers to those questions, I think will be helpful in breaking those barriers.
So let's turn to Dr. Femi. You study the connection between the gut and the brain. Now, I didn't know that there was really a connection other than like my brain knows I'm hungry, so I'm gonna go next door and get some ribs. I didn't know that there was a connection other than that. So can you tell us a little bit about the gut-brain connection, and why should we care in Black communities?
Yeah, I'll try and keep my answer a little bit brief because I can get really passionate about this subject. But the gut-brain connection, and the easiest way to think about it is that there is a connection between your brain and your gut, and it goes both ways. And some of this we kind of know intuitively, like you were mentioning, and some of this we've learned kind of over the years from experience, from research, et cetera. So the easiest way to think about it is that you have your central nervous system. That consists of your brain and your spinal cord. And that's how you experience the world. That's how you process your senses of sight, of smell, of hearing. But it's also how you control your responses to the world. That's how you move around. That's how you decide what you're going to say, those kinds of things. And then you also have nerves that go all throughout your body. And you have many, many millions of nerves within your intestinal tract. And that's called the enteric nervous system. And so there's a connection between your central nervous system and the gut nervous system. It goes both ways, like I mentioned. So in a normal functioning process, for example, say you smell really good food that's being cooked or about to be prepared, your central nervous system is going to send signals to your gut to say, hey, get ready to enjoy a really nice meal. So you might start to feel like your stomach is churning. You can maybe hear some gurgling going along, and that's actually because your brain is literally telling your gut, start to get working. Now, similarly, on the other hand, once you finish a really big meal, or say you overeat, say it's Thanksgiving dinner and you're just totally stuffed, the nerves in your gut are going to sense that your stomach's getting stretched, and it's going to send signals to your brain saying, stop eating. You know, we're feeling a little uncomfortable right now. Yes, the food looks really good, but we don't really need any more. And that uncomfortable feeling when you get too full is a normal expression of the gut-brain connection. Now, what can happen in many patients these days, and we're learning more and more, is that there can be a dysregulation of that interaction. So there are folks who will have that really full, bloated, uncomfortable feeling even when they haven't eaten anything or they barely eaten anything. There are people who their intestines either move too quickly or they move too slowly for the amount of food that they've eaten. And when you start having uncomfortable symptoms of bowel troubles, abdominal pain, bloating, oftentimes it ends up being something called irritable bowel syndrome, or IBS, which is very common. Now, on the other hand, you can also have folks who are dealing with chronic illness, whether it's inflammatory bowel disease or they've been diagnosed with a cancer of the GI tract, such as colorectal cancer, and there's definitely a feedback loop there. So we know that folks with inflammatory bowel disease are more likely to have mental illness. And on the flip side, if you have mental illness, that can also worsen your inflammatory bowel disease. And we also know that when patients are diagnosed with very life-altering diagnoses like colorectal cancer, that can also influence their mental health. So we're learning more and more about that connection. Some of it we kind of knew intuitively over the years, but with research, we're learning more about it and how to harness it and nurture it.
All right. I want to expand on what the doctor was mentioning. She wanted to be brief. I wish she had continued because she will be much articulate than I am in here, but I will say some stuff. And that is, in our gut, there are microbes, as you know. These microbes, the number of these microbes are billions. It's not just a little. So that's number one. Number two, any disease in your gut that you have may impact the number of these microbes and the type of these microbes. These microbes are not there just to be there. They are to do a function, and that function is not to hurt us. In fact, it is to help us. They make certain proteins, very small proteins called peptides, some of them. And these peptides are being absorbed to our blood and then goes to the brain, number one. They also release certain types of neurotransmitters. Those neurotransmitters, again, will impact your central nervous system, as the doctors are mentioning. So these microbes are very important to our health. What happens when the numbers are different and when the types particularly become different is that the number of good microbes will be reduced and bad microbes for us. Otherwise, microbes are microbes. Bad microbes for all health will increase, and they will contribute to certain elements, and one of them is inflammation. So when your body gets inflamed, then you are going to have all the different illnesses, which we will talk about, I believe, very soon, is that they will stand up for themselves and they will make life miserable for us. That's number one. Number two, as we all know, there is acid in our GI system, in the stomach. Many of the medications that we take change that acidity. And again, the doctor sees this every day and knows better, but I will just summarize. There are certain medications for acid, which many doctors are giving to be taken for long term. That is not so. You have to take it short term. Many medications are prescribed by different doctors, including psychiatrists. They will reduce the motility of your GI system. Not so. They have to reduce them. Not that they are not necessary, but they are necessary for short term. So it is a give and take all the time between our body through this system and other places. Thank you.
So now that we've discussed a little bit about the mental health, how mental health and chronic illness can interact and reinforce each other in a person's life, we want to talk more about strategies that we can actually use, in your sort of your day-to-day lives. So for Dr. Ali and Jonathan, where should young Detroiters go to find mental health care? What are the first steps? And what about mental health resources for older adults as well in the city? So Jonathan, we'll start with you.
Can you hear me? Okay, cool. I like to advise people, if you have insurance, to just pull out your insurance card and call the number on the back and talk to whoever answers about what services you're looking for, and they can match you with a provider that insurance will cover. If insurance is an issue, like if you're uninsured, I think Michigan.gov has free and low cost mental health services available. I think that was the first part of the question, right?
Yeah, and then really just, and for either of you, What would you say to people who are hesitant to seek out mental health care? I know that there's still a stigma. Maybe it's not quite as great as it used to be, but there's still a stigma as to, people reaching out for mental health care.
When I talk to people who are skeptical about the efficacy of mental health treatment or nervous about accessing mental health treatment for themselves, I try to just respect that for the strength that it is. Being suspicious or guarded about systems that have historically underserved large swaths of our population, I think is often like the right thing to at least start at. And I try to walk people through their individual experiences that might have informed that resistance or that skepticism. But I find that when you get like real preachy and say, it's wrong to be suspicious of mental health treatment, and it just doesn't go over well. So acknowledging that it's a strength to keep family secrets in your family, to do what the elders have taught you to do, like that is a strength. And maybe it doesn't serve you now at this point because you have like depression and anxiety symptoms that are impacting your daily life. But to give into that stigma is not necessarily bad all the time. It just can't end there. So I compare it to other elements of care. You wouldn't do your own dental work, hopefully. You would seek out somebody to do that for you, and you wouldn't think that it's a character flaw on your part to say, I couldn't do my own dental work, I couldn't heal myself. And it's the same for mental health, like it's a real legit field that people study, and they work towards being able to help other people go on their mental health journeys as well. So if you would seek a professional for any other kind of care, I would include mental health care with that.
Well, the hesitancy comes from different angles. First of all is that mind and body were not separate. We divided them up. And what we need to do, we need to patch it together. It's a cultural change. It is in every class or division of life and socioeconomic. So that's number one part. Number two, that hesitancy may be the result of the denial of the illness. Many people deny their illnesses, and that is not only with mental illness, it is with cardiovascular disease, it is with GI problems, unless there is some pain somewhere. And then you receive help, or you ask for help just to relieve the pain, not understanding the pain is a symptom alerting you with something much bigger. So it is the education to make people understand when you have pain, you need to seek help, but that is the first step, not the last step. But finally, what motivates people? We need to know what motivates those individuals. In general, a few of the areas which motivate people are giving the individual's identity. So if we try to talk to someone and value their opinion, listen to them, not trying to correct them, and that is with families, not only with physicians and all that, and listen to them, they will listen to us. They want to talk to us. We shouldn't talk to them. We should listen to them, and then when the time comes, talk to them and tell them that maybe we need to do A, B, C. Don't tell them what to do. Just give them the option. For example, you say, do you want to do this or the other? So people need to have choices to make. And when they feel that they have a choice, then they feel that they have control. Everybody looks for control in their lives. So it is something that depends on the training and education that we provide to the masses to learn how to talk to each other and how to talk to providers. And the last part is about providers. The system of care were designed based on paternalistic orientation. That means that I, as a physician, make the decision for you. Don't ask me why and how. And that it has changed to some extent. unfortunately still is there full force, kind of. And that system also needs to change. So let's not put it on the person who's hesitant. Let's help the person who's hesitant because there are reasons for him or her.
So Adria, as someone who focuses on holistic health and wellness, and you also teach about structures such as racism, white supremacy, capitalism, what are some just of the community-based strategies that you're engaged with to help Detroiters live healthier lives and be the best that they can be?
I think my mic works. So this is really exciting. I've been sitting here like nodding my head because I'm one of those patients. I'm one of those people. And I have many thoughts in this moment. And it's not just Detroiters that I assist people on a global level. So the people that come through the School of Radical Healing could be here, they could be in California, they could be in Canada, they could be in Kuwait, they could be in Cuba. Sometimes they're psychiatrists, sometimes they're doctors, because they're looking to exactly what Doctor was saying, to start approaching their work with a more trauma-informed lens. Because what we're speaking to, where these things generate, and there's been lots and lots of studies that show trauma is a direct link to our health issues. When we think about racism, it is a long-standing traumatic effect. It hasn't lost its impact. It just looks different, okay? And so my work is in holistic work. So even when we talk about brain and gut health, at the School of Radical Healing, we teach polyvagal theory. And we teach people this not just so that they have the knowledge, but that they can actually start to interact with their vagus nerve, which is what Dr. Femi was speaking to in so many ways. And it's interesting because so much of holistic practices are what interact with this vagus nerve. And most of us are in trauma response or stress response. We're in fight or flight. We're in survival mode. We're in freeze. And those things you feel in your body, you feel it when you're walking up the street, you feel it when you're at home resting. My work is to increase people's vagal tone. That's the work I do. And we do it through, there's so many methods that you could do it through. I specialize in yoga, breath work, and meditation. And what it's doing is it's stimulating that nerve and helping to bring a person back into their bodies. A lot of people don't like yoga. One, because of obviously if you come from a very religious place or you're just kind of anti certain things, it's like, okay, I like to teach people like, yeah, but the issues are in the tissues. That's what they say. So we need to have a release. The trauma lives in the body. There's a book called The Body Keeps the Score. It was the first book I ever read to help me understand if I had to live with this disease for the rest of my life, how was I gonna do it? How am I gonna make it to 40? I just turned 30 like a month ago, okay? Barely made it, okay? 19, almost lost my life. A year later, attempted to take my life due to severe mental health issues. And so how am I gonna make it to 40 to 50? How am I gonna see longevity in my life? And I agree that we need more informed practitioners, first and foremost. A person suffering, I got sick when I was 12, right? Anyone suffering needs a safe place to go to. So when people ask me, like, what am I doing? I'm teaching a trauma-informed approach. If we are traumatized people, then we need to cultivate a safe space to be able to breathe. But when I tell you to breathe, you're like, okay, but what does that mean for me? It's like you need to literally be able to breathe into that deepest belly you believe that you have. And that is my work and that's my passion. And I've used it to help myself, and I've used it to go into doctor's office and advocate for my own health. Give me choice. That is the work.
Yes, so absolutely. So I'm curious if I wanted to enroll in the School of Radical Healing, like what would that look like? What is the day-to-day sort of look like?
So there are many aspects of the School of Radical Healing. You could visit thesorh.com right now, and there's going to be a tab on the website that says the library. There are no books in this library. It's a bunch of videos of me teaching these somatic practices: yoga, breath work, meditation. That's your first free resource, okay? And what I want us to understand is we just learned that we have, nerves traveling through the body. We have all this knowledge now, literally just in a span of minutes. Now you also know I can interact with my own self. When you're breathing, when you slow your exhale down more than your inhale, you're tapping into parasympathetic nervous system, ventral vagal, rest, digestion, ease in your life. That's why we meditate. That's why we engage in breath work. That's why we stretch. That's why we dance and we laugh and we experience joy. That's why we do those things. And if you wanted to take it a step further and say, I need to know how to cultivate safe space for someone, then you would enroll in our program, which I lead 4 times a year. And people, like I said, from all over join. Because I believe in a trauma-informed future. I believe in a future where we're aware that we're going through things, that we've been through things, that it lives in our bodies, and you can enroll in our program. You could reach out to me. That would be a good starting point. Thank you for that.
Thank you. Absolutely. Dr. Femi, so I think one of the hardest things to do is to go to your doctor and to tell them I've been having issues, using the bathroom, right? Or, with IBS or constipation. Sometimes we think those are topics that we get really embarrassed about, right? So what are some what's some information that you can leave our audience with when it comes to gastro or gut health, and how should patients bring up these concerns to their doctors? What are the best ways to do that?
All right. So, yeah, I'm glad that we're talking about this. So, a couple of things just as a reminder, because I think you had mentioned some of this earlier, and Dr. Ali had also mentioned this as well, is that the Black community is disproportionately affected by GI disorders. Well, by chronic illnesses in general, but specifically of the GI tract. So we have higher rates of diagnosis of colorectal cancer. When we're diagnosed with colorectal cancer, we have higher mortality rates. Black patients with inflammatory bowel disease, which includes Crohn's disease and ulcerative colitis, if I didn't mention, have more aggressive diseases. They are more advanced when they're diagnosed. They have worse outcomes. And when Black patients with Crohn's disease or ulcerative colitis do ultimately have surgery, we tend to have worse outcomes after that surgery. So I say those things not to scare you, but just to make sure that you're aware. And then that's why it's so important that you do feel comfortable speaking to your doctor about all of these issues. So the first thing I'd say is that to make things a little bit easier when you're going to talk to your physician is to increase your awareness of what's going on with your body in the first place. And the easiest way to do that is to look. And it sounds really gross, but I tell all of my patients to do this. You want to pay attention to what you're putting into your body, what you're eating, but you also really want to pay attention to what's coming out of your body, which means when you go to the bathroom, you want to look. So I'm GI focused, obviously that's my specialty, so I'm talking about looking at the poop. But it's also important to take a look when you urinate as well, because when you notice changes in what's coming out of your body, that can often be a very, very early sign, far before any sort of test that we could do that there might be something wrong with your GI tract. So what do you want to pay attention to? So in particular, just the color of what's coming out, how frequently you're going to the bathroom, the consistency. And I'm sorry, I know we're talking about this right before we're going to eat, but you need to get more comfortable with it. Are you seeing blood? Are you seeing anything is it uncomfortable to have a bowel movement? Those are all things that you shouldn't feel embarrassed talking to your physician about. Those are things you should pay attention to and definitely bring them up. Now, in terms of when you do go and see your doctor, I think Dr. Lee had mentioned this as well too. It goes both ways. You know, a lot of times I think we kind of put the onus on the patient. And you know, if a patient has a bad outcome, well, they didn't tell me, they didn't come see a doctor early enough. But a lot of it is we also need to improve the way we communicate with patients as well. But you should know that when you're seeing a doctor about any issue, whether it's you're seeing your primary care doctor, your gastroenterologist, any specialist, we do this day in and day out. You know, you may feel embarrassed bringing it up. That may not be the kind of thing you would talk about with your friends or your family, but with us, we're professionals, and everything you tell us is going to be confidential, and absolutely nothing you tell us will shock us. We've seen it all. So the first thing is just, you know, part of it is, you know, having the courage to bring it up in conversation, and, you know, pay attention to what the physician is telling you. So a lot of times, unfortunately, I'll see patients, and, you know, it happens with everyone, but particularly people of color will come to see me and they'll say, you know, I told, you know, another doctor this, and it seemed like they didn't listen to me and they didn't do anything. And one response to that absolutely is just, you know, just go find another doctor, and that's just fine. And that's just fine. And sometimes that is just the appropriate response. But also, if you feel like you're not being heard, you know, be insistent about it. You know, you're coming to see us because you're concerned or you're in need. And our job is to be there and listen. And so if you feel like your concerns are not being heard, again, don't feel you know, ashamed or anything to ask again, and, you know, repeat what the doctor said to you, so you really don't think anything's going on. And I just want to make sure that you know that I said this. And sometimes it also just means that you need to find another practitioner, which is not always easy. But sometimes you got to jump around until you find someone you feel comfortable with. But I think the first thing would be, you know, you get comfortable in yourself and know your body. Pay attention to what's going on with your body. That'll make it easier for you to communicate. And then, you know, definitely take ownership of your own health, because you're going to be the #1 person. And if you don't feel like you're being heard, you need to move on.
Okay, thank you. I think we are going to take some time for some questions. We have a little bit of time for some questions. But I do want to say, for the men in the audience, whenever I get like a microphone to just talk with people, I always say, men in the audience, go get a colonoscopy. Like, do it. Don't wait, just do it. Let's take some questions. If anybody has any questions or any comments about what we talked about, if anybody has some questions for our esteemed panel.
Hello. Okay, I heard everything you said. It was very informative. I grew up with a mother who was diagnosed as paranoid schizophrenic, like my whole life. So she was in and out the hospital. Back then they called it nervous breakdowns. So fast forward, I have a nephew who's in his 30s now, and he was diagnosed with the same thing. It's really hard trying to get help for someone who is already past the age of 18. So he would have different episodes. My sister would call the police. They take him to receiving. They sent him someplace for 2 weeks, then he would be out. Then he started living in a group home. Group homes are not set up to handle serious mental illness. I called several places trying to get help. The first thing they would say is, how old is your nephew? When I told him how old he was, there was nothing else I can do. There's nothing you can do. He's over 18. He doesn't know how sick he is. He's in jail now. That's the only time that our family feels safe, is when he's locked up. What can be done for a person who's over the age of 18 who does not know how sick they are? They can't look on the back of their insurance card to get help because they don't think anything is wrong with them. So how can we, as the public, change whatever needs to be changed? Because there are a lot of people who are living in group homes who have mental illness, and as a result, my sister is not with us today because of her son killed her. So what do you do when someone doesn't know how to get help from themselves?
The reason I started my conversation was, in fact, because of the systems. And we have a sick system. The system was not designed to help this type of patient. If you remember, we used to have long-term hospitals. And we also had alternatives to hospitals which people could live and stay and do and enjoy and be part of something. Those were demolished and are replaced with these group homes. So, regretfully, most people who have the serious mental illnesses like schizophrenia end up in those group homes. The problem is that the staff in those group homes themselves, because of lack of resources, are faced with severe stress in their lives because of the type of work that they do. In fact, many of my patients are those who are supposedly or trying to provide care and be supportive of the people who are in those group homes and have severe mental illness. We used to have a program for them to educate these individuals. Unfortunately, because of possibly lack of resources, or possibly because of policies and many other things, including politics, I don't see any evidence of those programs for these staff in group homes to educate them and learn how to communicate with the severely mentally ill. The best thing that you can do is just advocate for your loved one. Don't give up. Call whomever you can and raise hell. If you speak loudly and stay persistent, you will get what you want. Don't give up. Talk to the politicians in your community. If it is a spiritual leader, talk to that spiritual leader, not diverting you from treatment, but advocating for you to receive care, and force them to do something for you. They don't want to hear from you. You know why? Because it makes them uncomfortable. Because they don't want to hear from you, they will call someone else. And that person will call someone else. Finally, you get something somewhere. Probably it's not going to be perfect treatment program that you can find, but you will find something better than what you are going through. I hope I answered partially your question.
Hello. I live with lupus, and it is an autoimmune disease as well. And it affects you and others differently. I have, I think they call it SLE, I believe. It affects my joints. So I get a lot of swelling and a lot of pain, and it's all over the place. It's everywhere. I believe one time my ear was actually just aching, but there's no real treatment for it. You take medicines and anti-inflammatories, and nothing really helps. You know, and the only time that I truly have ever really gotten relief to the point where when I was, you know, in a crisis, is what we call it, I had to go to the hospital, and I had to be extremely medicated with strong drugs that they can't send you home on. So, and that then in turn affects your mental state, because you live with this every day of your life, and then you have to kind of sort of live with the pain, learn how to adapt to being in pain every day. And then you become depressed and you have moments. I can't even do the yoga. I've been, it's been suggested. I can't do that because, I would love to be able to get down on one of those, and I would love to be able to get on the floor and play with the kids or even cross my legs. But I can't. What do you do?
So the style of yoga that I teach is trauma-informed yoga. And one of my clients has lupus. When she comes to see me, we don't actually do any postures. So the first thing I want to say is these aren't blanket suggestions, right? Because yoga might not work for you, literally, for your body. Sitting and getting in touch with our breath. I'm a doula as well, and one thing that we teach birthing people when they're going into labor is to breathe, to manage their pain. The breath work is not just take a few deep breaths in. There's breath work that can last for 45 minutes. There's breath work that can last for 30 minutes. But if someone was to literally ask me the question you just asked me, my first thought is breath work, is being able to breathe, being able to manage your breath. That is the very first, and again, I'm not a doctor sitting up here. I'm a person who lives with a chronic illness and chronic pain and has had to also avoid the opioids and avoid the things that are given, right, but don't really, they just bring your pain back with vengeance, really. And so when you ask me that question, my very first thought is breath work, and belief. And I think there aren't many things to believe in, sometimes it feels like, when you live with a chronic illness. And so when I suggest that, it sounds almost like woo-ish, okay, she want me to breathe, all right. I'm so serious, I'm so serious about it, to really develop a practice where you get taken away by your own breath. You become enthralled with your breathing every day intentionally. We wake up, it's an autonomic process. You're breathing while you're asleep, you're breathing while you're sitting here, but what if we actually nurtured the breath? What if we actually developed it, just like we do in the gym, just like we do in other areas, and you don't need to move to do it. You can prop yourself up on some cushions, make your body nice and comfortable, and that is the first thing that comes to my mind. And I just want to acknowledge that it's never a blanket statement of go do yoga, because some people absolutely cannot, and I acknowledge that, so thank you.
Can I?
Yeah, I'm sorry. I also wanted to add to that and put in a plug for group therapy and support groups. What you're talking about, the way that you articulate your experience with lupus, it might not be something that everybody in this room can relate to, but in a group with people who have lupus, and I personally, lupus runs in my family, so I'm familiar with what you're talking about. There's something to be said for that shared experience, being in a circle of 10 people who are experiencing the same things. We're talking about what we're going through, how we'd love to be on the floor with our kids and those kind of things, and you don't have to explain it to somebody who doesn't understand. There's a mental health benefit to that, just sharing your experience, hearing the experience of others, getting solutions from people who have been where you've been or where you are. Yeah, so group therapy.
Can you hear me? Okay, yes. One other thing I would mention is that we're now really fortunate to live in a time where, we have traditional medicine, which I practice, but then there's a lot of alternative medicine options that I often refer patients, not with lupus, but with things like Crohn's disease, GI, autoimmune conditions. So in addition to a restorative yoga practice and breath work, which I'm learning so much about just hearing from Adria, things like acupuncture, massage therapy, there are a lot of benefits that you may actually have access to, and these don't necessarily need to be expensive out-of-pocket things. Oftentimes in patients with chronic pain that we can't control with traditional methods, these may be options to you through your insurance as well. So I would speak to your primary doctor, your rheumatologist about it, because really all your physician is going to want, and all of these practitioners is to help you. And if our medicines aren't doing it for you, they should be happy to suggest other methods.
I would like to add something which is going to be helpful for all of us, I believe, and that is don't take breath work easily. It is a serious biological issue. We don't have the time to go over what it really does, but it is very body related. It's not just something that we are breathing and we are feeling better. There's a reason you are feeling better, and there is a reason you are not feeling better if you are not practicing it the way that you should, and you need to learn how to do it. So that's on its own a very big topic of conversation. However, since you mentioned I have autoimmune disease and SLE, as you mentioned, this is an inflammatory illness. So if you don't mind, I focus on inflammation a little bit. The issue on inflammation is the response of the immune system when it is facing some form of threat. That threat can be a cell which is identified as foreign by the body, like in autoimmune diseases, or it can be a virus, like COVID, or bacteria, like pneumonia. And all these will create inflammation. So the body will try to kill this element, whatever it is. In this, the brain and parts of the brain will start making adjustments, so they will release all the white blood cells, for example, or the autonomic nervous system as was discussed, and all these things, and they make some changes in there. You have the power to help your autonomic nervous system take control back. So you take control back from those elements, and that's one of them is through breath work. But at the same time, when your body is fighting, there is one piece which is not thinking about because it wants to survive, and that is your health. In other words, the body doesn't care if you come out of that fight happily. It wants you to survive. What we need to do as individuals is to train our brain again that I am going to overcome, and if you say it and try to do it, you will do it. So most of your response will come from within you, and I'm not being spiritual in here, by learning how to deal with these things. So dissecting it for you, it is that what we can do to reduce general inflammation, and that is enough sleep. That is extremely important. Having the appropriate diet, especially that you have lupus, and what to eat, what not to eat, because there are many things which are bad for lupus. Don't have processed food, for example. That's something which you need to have. Positive socialization. Interact with people who are positive. If there are negative people around you, just run away from them. Don't stand by them. Just run away. And smoking, drugs, alcohol, no. And anything which is going to be exposing to stress, because stress and trauma doesn't exist out there, it is inside us. What exists out there is an event. Our interpretation of that event causes stress in us. Stress, what does it do? It goes through our immune system. It goes through our autonomic nervous system. So you have more control than you even imagine. The issue how you to learn it and then execute it. So
thank you, Ms. Khadija. Very special thank you for you guys being here. This is so rich and so very robust and healthy. You're speaking to so many of the issues we all live. So a couple of quick questions. I want you to expand a little bit, if you will, on anxiety and depression and the fact that we don't exercise and walk and care for ourselves at the level we know. Many of us are brilliant enough to know the benefit of walking, for example. And I too am a yogi, Madam Yogi. I love, oh my God, makes a difference. But arthritis, blood pressure, cholesterol, diabetes, enlarged prostate, half of us have that. I have arthritis, so walking and yoga makes a difference for me. Do you follow me? But why is it that anxiety and depression holds us back? And the last question is, can any of these chronic diseases be reversed? Can we absolutely stop blood pressure? Can we absolutely stop cholesterol issue? Can we absolutely reverse diabetes? Can we absolutely address prostate issues? Thank you so very much again for being here.
Anxiety and depression, anxiety disorders are the most commonly diagnosed disorders in America, so with good reason. The things that we go through, often anxiety and depression, or at least the symptoms of, are logical responses to our experiences. So I think that's why it's so prevalent. Also, with exercise, regular exercise, often the issue is that once we do it, we can do it once, and it's not going to do anything. And then we do it again the next day, and it's not going to do anything. It's the cumulative effect of doing it, let's say 30, 60 days daily and faithfully. And anxiety and depression gets in the midst of that. You know, as we're on day 2, day 3, we're looking in the mirror. We don't look any different. We're experiencing often the same things. So it helps, I'm biased maybe, to also have a talk therapy practice integrated in there, where we can talk about our wellness, our physical wellness journey, and how our mental health has impacted that journey.
there were 2 issues which was mentioned right now, and I want to expand on them and then add a little bit more. Number 1, exercise. Exercise, if done correctly and appropriately, has similar impact like antidepressants. This is recent findings. So if someone exercises, you receive antidepressant help and also anti-anxiety help, 60% of the time. That impact is similar to antidepressants. The second piece is about therapy. Combination of therapy and medication is much more effective than one of them. So if you are not receiving therapy and someone you know is taking medication, encourage them to receive therapy. It is absolutely important. Going back to anxiety and depression, the leading cause of disability in the world, you know what it is? It's depression. There are 3 other components in here. Cardiovascular illness is one of them. Diabetes is second one. And pain is the third. Those are the ones which are leading causes of disability and death. So what can we do about them? To ask for help and receive the help and implement what they are asking you to do. I'm going to say something about something I read and I have been thinking about for quite some time. A Sufi master, Professor Nader Enga, has said, hope is planted seed in fertile soil which bears fruit. And I have been thinking about it. For us, if this conversation here is the seed which goes inside you, and if you are that fertile soil, you need to bear fruit. The fruit that you have inside you is implementation of whatever you have to do to get rid of the symptoms that you have, because those symptoms, again, those illnesses that we talk about, are results of imbalance in our systems, which have created chaos inside. And again, goes to inflammation and all those. They're all interrelated. And one other thing, there was someone asked about resources in the beginning, as you discussed. In Detroit, Detroit Wayne Integrated Health Network is the one which deals with those who do not have insurance or have Medicaid, and organizations like NSO, Neighborhood Service Organization, are the ones you contact and receive the help that you need. If they don't deliver, they will help you to receive the help that you can from other places.
And then I just wanted to add a little bit about, you're also asking about, kind of chronic medical conditions and how much does a healthy lifestyle really impact, or can we reverse these conditions? And the way I like to think about it is that everyone has a different likelihood or propensity to have these disorders. We all know someone who smokes, drinks, eats terribly, never exercises, and they go to the doctor and they get a clean bill of health and they live till they're 95. And on the other hand, we all know folks who seem very healthy, active, and unfortunately they get struck down with really debilitating conditions when they're really young. And some of this is genetics. Some of it is exposures early in life that you have no control of. Now, when you're diagnosed with something like, say, high blood pressure or diabetes, now everyone has a certain likelihood of being diagnosed with those conditions, but your lifestyle definitely influences how severe it is. So, for example, if you're someone who's diagnosed with typical type 2 diabetes, absolutely that can be cured with healthy diet, exercise, and weight loss. Something that I see pretty frequently is something called fatty liver disease, where if you eat an unhealthy diet and you're not exercising well, you can have fat deposition in your liver and it can lead to cirrhosis, and ultimately these patients can need liver transplants if it gets that severe. But if it's caught early and you make those steps, absolutely fatty liver can go back to a completely normal liver. So, if you're diagnosed with any of these conditions, yes, there's medications, but the first thing you really want to work on is lifestyle. And, it may just be that your body, even if you have the absolute perfect quote-unquote diet and you're doing all of the recommended exercises, you may not get back to completely normal, but it's going to be better, and you're going to feel better, and your mental health will benefit as well from eating a healthy anti-inflammatory diet and plenty of exercise. So it's always worth the try, even though, some of us are just born with bodies that don't want to cooperate. It's always worth it.
Awesome. Thank you. And I'm going to let Phil wrap up the panel. The panelists will still be here. We'll still be here until 5. I just want to make sure everyone can get up, stretch, get some water, get some food in your systems, please. But I'll let Phil wrap it up. But we'll be here to answer any questions.
Yeah, so. Hello. Oh. Thank you. Okay, we got a bunch of mics. So honestly, this is one of the fun parts of my job. I get to just sit and listen and just ask questions, and smart people tell me things, and sometimes I get to write about it. So that's it's always fun. Thank you to everybody. Thank you to our panelists. Can we please have a round of applause for our panelists? Your insights were amazing. Thank you very much. Like they said, we'll be around if you have any questions. We'll be hanging around if you want to ask. I don't know if maybe you'll ask me something. I don't really have anything to say, but yeah, thank you very much for joining us, and please get some food and enjoy the rest of the time here.